All right, so the liver can get crazy. Okay, so let's talk about cirrhosis first. What is cirrhosis? Okay, it's a degenerative disorder. What is degenerative? Breaks down. Okay, breaks down. Degenerative disease of the liver. Okay, this is where the lobes are covered with fibrous tissue. All right, this is also known as like fatty liver disease. Fibrous tissue, and then the lobules are filtrated with fat. That's why it is known as fatty liver disease, because it's covered in fat. Okay, that is cirrhosis. Okay, cirrhosis of the liver. Degenerative, fat. Okay, fatty liver. What do the early stages look like? The liver becomes firm. Okay, the liver becomes firm. Generalized weakness within our patient, malaise, vague like flu-like symptoms. Okay, later stages, what does it look like? Okay, upset stomach, ascites. Okay, please know what that is. Ascites. That's that fluid, that big abdomen caused by fluid. Okay, jaundice, yellowing of the skin. All right, malaise, spider angioma. Okay, spider angioma. All right, definitely need to remember all of these. Those are the later stages, early, later. Diagnostic testing, the test that they're going to run, please run through that video that I just recorded talking about this. Okay, medical management for this, eliminate the cause. What is causing a fatty liver? Cut it out. All right, decrease the buildup of the fluid. Okay, prevent any further damage. Provide support to your patient. Diet is key. We know that our liver is already fat, so we're going to reduce our fatty foods or cut them out completely. Okay, well-balanced diet, high calorie, moderate to high protein level foods, low sodium intake, additional vitamins and folic acid, antiemetics in case they're nauseous and or vomiting, in which in this event they will be. Okay, complications, esophageal varices. Okay, esophageal varices, what is that? That's little pockets that form filled with blood. Okay, build up in our esophagus. They're like little pouch-like sacs in our esophagus lining, and they build up with blood. All right, so imagine if one of those were to burst. You're gonna bleed out inside. Woo! Okay, ulceration, hemorrhage. Okay, those are some complications from that. Non-selective beta blockers, propranolol. Okay, and then lab tests. BUN is performed to determine that the GI tract is digesting and absorbing the blood. Okay, rupture can be slow or sudden. All right, an EGD would help you to identify and see the varices. Okay, also sclerotherapy. All right, ruptured esophageal varices is a medical emergency. Again, bleeding, they can bleed out internally. You want to maintain the airway. They can aspirate on their own blood, choke on their own blood. Okay, so maintain the airway, control the bleeding, IV fluids, blood replacement. Okay, vasopressin. All right, and ENTG. Okay, gastric lavage. All right, band ligation to kind of put a rubber band on it to close off the bleeding as well. Okay, these are some things that can be done to help with the complications. Okay, more complications: portal hypertension, shunts, hepatic encephalopathy. Okay, brain damage caused by liver disease and ammonia intoxication. Okay, inappropriate behavior for cirrhosis, asterixis. Asterixis is this. It's that flapping of the hands. Okay, twitch. It's like a twitch or a flap. Okay, poor diets, having low proteins. Okay, these are all complications that could cause or make cirrhosis worse. All right, one of the main ones, fluid retention. Okay, this is one of the main ones I need you to remember as well. The asterisks, the ascites, fluid retention for sure. Okay, diuretics are usually given to decrease fluid retention. Okay, albumin may also be given to increase the osmotic pull into the vascular space. Okay, to help get that fluid off. Okay, a paracentesis. A paracentesis may be performed where they stick a needle in and extract the fluid and pull the fluid out. Okay. Nursing interventions, monitor the vital signs, monitor the fluid status and the INOs. Okay. Monitor the lab values that we just went over. All right. Place the client on bleeding precautions when appropriate. Monitor for GI bleeds. Okay. Provide excess education. Direct the client to resources to deal with alcoholism if appropriate. Okay. Alcoholism is a risk factor for cirrhosis. Okay. Patient teaching. Avoid over-the-counter drugs, specifically acetaminophen or drugs that are very harsh on the liver. Avoid them completely. Avoid alcohol. Okay. The liver is already damaged. All right. Avoid alcohol. Okay. Administer lactulose. Okay. Lactulose is a bowel cleansing medication. Okay. And then antibiotics if needed. Okay. Antibiotics.